Welcome to Today with Dr. Kaye. I'm Dr. Kaye Wise Whitehead. I'm joined now by Dr. Anthony Fauci, the country's top leading expert on infectious diseases. Dr. Fauci, let me begin by thanking you for your leadership, for your wisdom, for your steady hand during this very difficult time. We truly appreciate you, sir.
Well, thank you for saying that. I appreciate it. Thank you.
So I want to talk about the impact of COVID-19 on the African American community. We have a long history of distrust of the medical community based upon very real incidences that have happened where our bodies have been used in inhumane ways. What is the messaging that you think we need to give to the Black and the Brown and the Indigenous community to get us to trust the possibility of using a vaccine when it's made available?
Well, yeah, thank you for that question. It's really important because one of the ways you get people to trust is by showing them all the information in a very transparent way so that you can actually make up your mind for yourself as to why we feel that the vaccine is safe and effective, and that it's very important for the African American and other minority communities to get vaccinated. Because if you look at the data, the African American community suffers much more disproportionately than the general population from COVID-19. First of all, by the nature of the kinds of jobs that most of people have in that demographic group. They're out there in the community. They have essential types of jobs that put them into contact with people as opposed to being able to be looking at a computer and speaking to a computer. And it turns out they have a higher incidence of infection to begin with. But also because of the decades-long social determinants of health, they have an incidence and a prevalence of comorbidities or underlying medical conditions that make it much more likely that they will have a severe outcome if they do get infected with COVID. So without a doubt, vaccines are very important to the African American and other minority communities. Having said that, it would be terrible if we have, which we do have, more than one highly efficacious vaccine to the tune of 94 to 95% against any kind of COVID disease and almost 100% protection against serious COVID disease. It would be tragic if African Americans didn't have access to or didn't want to get vaccinated when you have an intervention that could be life-saving for them or even certainly keep them out of the hospital. So what we need to do is to make sure that they understand that the process of the development of a vaccine is really the result of exquisite advances in platform vaccine technologies. So it went quickly, not because corners were cut or that there was reckless speed. It went quickly because we utilized these exquisite scientific advances. And we also invested an extraordinary amount of resources to the tune of billions of dollars to make this process run smoothly and have enough doses available when the vaccine trial proved to be safe and effective. The question everyone asks is, how do I know it really is safe and effective? Are you trying
that was my next question.
Yeah. Are you trying to put something over on us? Is this a political thing? Is just the company trying to make a lot of money, or what's actually going on? Well, let me tell you about the process, and I think you'll be convinced that this is something that you could have confidence in. When the clinical trial is done, namely, we have tens of thousands of people in the two trials of Moderna and Pfizer. Moderna had 30,000 people in the trial. Pfizer had 44,000 people in the trial. So you get a lot of data. The data is looked at first and only by an independent group of people who are clinicians, vaccinologists, infectious disease people, immunologists, statisticians, ethicists. They are completely independent. They are beholden to no one, not to the federal government, not to the president, not to the drug company. They're beholden to the American people. They look at the data independently, and then that board decides whether the data is good enough to be able to say the vaccine is safe and effective. When they do, the data then becomes available to the company. Only then does it get available to the company.
Okay.
Then the company applies to the Food and Drug Administration for an emergency use authorization and ultimately for licensure. The career scientists at the FDA, not the politicians, but the career scientists, people that do this every day, the professionals, they look at the data, and together with yet again another independent advisory committee called VRPAC, which stands for the Vaccines and Related Biological Products Advisory Committee. That group advises the FDA to make the final decision as to whether or not you could take the vaccine. So it's both transparent and independent. I don't think that that is fully appreciated on the outside.
I'm just wondering, in terms of the trial studies, did you have enough African Americans participating in the trial studies? How about children under the age of 18 to really look at the impact of this in our community and on our children?
I'm glad you asked that question, because we spent a lot of time making sure the companies had a good component of African Americans and Latinx. In fact, for about 8 or 9 Saturday mornings in a row at 10 o'clock, I and my colleagues, Dr. Collins, Dr. Mescola, Dr. Lane, we met with the companies to make sure that they recruited enough African Americans and enough Latinx so that when the trial is over, you can say that we showed that it was safe and effective in everyone, including African Americans and including Latinx.
Now, if I take the vaccine, does that mean I can then take my mask off and go live my life? Like, is it a 2-part vaccine? Is it like a flu shot? Like, what does that actually mean when this vaccine rolls out?
Well, it will protect you, 95% protection. But since we don't know if it protects against actual infection, it certainly could protect you from getting sick. Mm-hmm. And that there will be a lot of people out there who might not yet be vaccinated. It is important that you don't abandon public health measures until we have enough people in this country vaccinated that you have this umbrella of herd immunity that the virus has no place to go. So the virus is going to be irrelevant. It won't get to that point until you have the overwhelming majority of the people in the country getting vaccinated. So you can have true herd immunity and protection of everyone.
Now, when we look at the numbers, and we've been following the numbers and the data, finding your words very closely and looking at them, we always hear that it disproportionately impacts the African American community. What does that mean? Do we have a higher number of Black people who are dying from this, who are getting it and being long haulers? It's hard to figure out exactly how it impacts our community, even with the comorbidities in place.
Well, I can tell you exactly how. What it does is that because of the higher incidence of infection and the higher percentage of comorbidities like diabetes, hypertension, obesity, chronic liver disease, chronic lung disease, those kind of diseases that is more prevalent in the African American community than is prevalent in the general population, you have A, more infections, B, more hospitalizations, 4 times as many hospitalizations, twice as many deaths than the normal population.
And that is, of course, stirring a lot of fear within our community. We're hearing all this information from the CDC, from WHO. So where should we go to get the most accurate information to cut down on the confusion and hopefully down on the fear?
Well, I think you should go to the CDC website. They have an excellent website. You just go onto your computer, put cdc.gov. The CDC webpage will come up. They have a little search engine on the right-hand side. You type in African American COVID, bingo, it'll come up and you'll be there.
Now, there's a vaccine rolling out in the UK next week. What exactly will you be looking at in terms of how effective it's going to be as it potentially comes to America? Sure.
Well, that's the same vaccine that we're working on. That vaccine was tested in the United States. So the Brits are approving it, which is good, but that's the same one that is now being evaluated by our FDA, which should be available, within a week and a half from now.
There's a fear that people have that in terms of taking the vaccine and going back to normal, that we're opening ourselves up to have another issue. when we start talking about down the road other pandemics, what would normal look like for you on the other side of this vaccine?
Well, normal would look like that we're no longer terrorized by this terrible pandemic, but that we will have a better capability of preparing for the eventuality of other pandemics, which will occur. I mean, I hate to say this because it's been prophetic. If you look at things that I have said 3, 4, 5, 10, 15, 20 years ago, was always sooner or later, we're going to get hit with a really big one. And unfortunately, that's this. Pandemics have always occurred. It's nothing new in history. If you go back in history, there have been pandemics long before recorded history. The worst one that we've had was in 1918. Then it was 1957, 1968, 2009. Now we have COVID in 2019. We will continue to get outbreaks. There's not much you can do about an emerging outbreak. What you can do, however, is you can prevent it from becoming a devastating pandemic. So new pathogens will emerge for sure. It's up to us to prevent them from becoming explosive outbreaks the way this one did.
And we've heard there's a plan to wear a mask for 100 days when our new president is inaugurated.
Right.
Do you think
President-elect
100
Biden.
days
Yeah.
is that enough time?
What do I feel about that? I think that's a great idea. and I told President-elect Biden that I thought it was a terrific idea, because what he wants to do is say, listen, I know there are a lot of people that don't want to wear masks. Let's do this for at least 100 days. Let's everybody do it and see what happens. And I'll show you that it likely will have a good effect. And then you likely would want to wear it beyond 100 days. But what he's saying is, says, at least grant me 100 days of wearing a mask by everybody.
One of the things that I heard you say, that if we can get at least 70% of the population, that herd immunity, to take the vaccination, we can get back to normal. The
Right.
question is, beyond the African-American community, how do we convince 70% of the population? We couldn't get 70% to wear a mask. How can we convince them to take the vaccine so that we can have that herd immunity you were talking about?
Well, I think it's the same thing that I mentioned a few minutes ago when you're trying to address it with the African-American population, to be very open, honest, and transparent with people about the process of the vaccine being shown to be safe and effective. It's an entirely transparent and independent process. Now, there's going to be a certain percentage of people, no matter what you tell them, they're not going to want to get vaccinated. That's just life. You got to face that reality. But there probably are a lot of people who don't want to get vaccinated because they're not well informed enough about A, the benefit of the vaccine, and 2, that it really is quite safe and surely very effective.
Dr. Fauci, we just appreciate your time. We thank you for the work that you're doing. And just to recap, it's something we should look at doing. We should take the vaccine. It'll be safe for both us, for our parents, and also for our children, that those who are under the age of 18 that we are most concerned about in terms of getting back to school.
Right. Thank you. Thank you for having me on your program.
We appreciate you coming on, sir.
Thank you.
So folks, that was Dr. Fauci, the nation's top leading expert on infectious diseases. Please stay with us for more conversation when we return.